Hello viewers, this is Dr. Sangeeta Datta, consultant psychiatrist, and today we shall discuss about schizophrenia. Schizophrenia is a psychotic illness in which a person loses contact with reality and gradually goes into a world of imagination or fantasy. In schizophrenia, a patient often does not realize that he is unwell, mentally unwell, and thereby it becomes even more important for his relatives and friends to observe his behavior, observe the changes in his life and his behavior, so that they can take him to a mental health professional. In schizophrenia, we can have variety of symptoms. However, the commonest symptoms are as follows. Usually there is fearfulness and suspiciousness. A person who's suffering from schizophrenia will be afraid that people are trying to harm him. In reality, there is nothing like this, but he is constantly afraid and he suspects almost a lot of people, almost everyone, that they are trying to harm him and they are his enemies. Initially, these kind of suspicions are about one or two people, but gradually as the disease worsens, this extends to everybody in his environment, including his relatives and friends. Apart from this, there is sleep disturbance. Sometimes the patient talks to himself, which is called muttering to self. Sometimes such a patient smiles to himself or cries for no apparent reason. Apart from this, such a patient becomes such a person becomes very irritable and gradually withdraws from his family and friends. He remains mostly behind closed doors in his private space, and there he might indulge in activities which are not normal. There could be excessive amount of philosophical thinking also, and such a person suffers from different thought disorders. We refer to it as thought disorders, in which the person, as I said, has persecutory ideas, he's afraid, he's suspicious, and these are called delusions. Apart from this, sometimes the person hears voices of people or sounds when nobody and nothing is around. This is called auditory hallucination. Apart from this, the person may see another human being or another animal or something else when nothing is there in his environment. This is called visual hallucination. Sometimes the person may feel somebody's touch when no one is around. That's called tactile hallucination. Sometimes the person may taste something in his mouth when he's not eating anything, and that is called gustatory hallucination. And sometimes he might get a smell of something when nothing is around, and that's called olfactory hallucination. Usually the awareness about schizophrenia is so poor in the society that when a person talks about hearing somebody's voice or somebody trying to harm him, people do not take it seriously. They think it is imagination, it is not a disease, and they try to explain this to the human being that, well, we are not hearing anything, so you can't be hearing anything. So because people are not aware of what hallucination or delusions are. Apart from this, these are called positive symptoms of schizophrenia: being fearful, suspicious, being irritable, being aggressive at times towards oneself or towards others, destructive at times too, and not sleeping at night, and sleep gets disturbed. Sometimes there can be negative symptoms too, in which a person stops taking care of himself, does not bathe, does not cut his nails, he does not comb his hair, and then remains very dirty and neglected. He doesn't talk much and shows withdrawn behavior. These are called negative symptoms. What I have mentioned just now are mostly the symptoms of a pattern of schizophrenia or a type of schizophrenia, which is called paranoid schizophrenia. But there is another variety of schizophrenia which is called hebephrenic schizophrenia, which is found mostly in adolescents, both boys and girls, and sometimes even in childhood. In hebephrenic schizophrenia, the symptoms are slightly different from that in paranoid schizophrenia. Of course, there is deterioration in studies and the child's behavior changes, and the child shows behavior like repeated mirror gazing and smiling at oneself in the mirror, or even giggling. There can be fleeting delusions and hallucinations too. So, however, it is not as constant and as persistent as in paranoid schizophrenia. It is noteworthy that girls or adolescent girls who suffer from heavy phrenic schizophrenia have a better prognosis after treatment as compared to adolescent boys. Then there is something called catatonic schizophrenia, in which the symptoms are slightly different, where a person maintains a posture, a very uncomfortable one, for prolonged periods of time. Like the person might just stand on one foot for many hours, or might just lie on the bed and the head not touching the pillow, and the head is raised in above the pillow, and in this posture the person may be lying on the bed for a long time. So there can also be other symptoms like retention of urine and stool in catatonic schizophrenia. In certain varieties of schizophrenia, like undifferentiated schizophrenia and psychosis not otherwise specified, we get to see a variety of symptoms which could be an admixture of symptoms of paranoid schizophrenia, heavy phrenic schizophrenia, and catatonic schizophrenia. Schizophrenia is a mental disorder and it can be treated effectively. Earlier you bring such a patient to a psychiatrist, the better, because symptoms of such a patient will respond earlier to treatment if the duration between the onset of symptoms and the onset of treatment is very short. The biggest challenge that we face in schizophrenia, in treating a patient with schizophrenia, is that such patients are not aware that they are mentally unwell. So they refuse to come to a doctor. And mostly when friends and relatives try to explain this to them, that, well, you're talking to yourself, they deny things. As a result of this, they refuse to come to a doctor. Sometimes they are tactfully brought to a doctor, or sometimes they are forcefully brought to a doctor. Sometimes they cannot be brought to a doctor at all. In fact, they even suspect their relatives and the doctor for conspiring against them. And as a result of this, we do have wonderful medicines to treat schizophrenia, but they may even refuse medicines. Some patients take medicines and hide it below their tongue and later spit it out. So they don't ultimately swallow the medicines because of suspiciousness and because of the fact that they do not think that they are unwell. As a result of this, it becomes a challenge to treat schizophrenia, very aggressive, and because of poor drug compliance, we may have to admit a few patients in the hospital and give them injectable medications to treat them. Apart from that, we can also mix some medicines with food so that the patients can be treated at home. Therefore, beware of any symptom developing in any of your near and dear one, which may suggest a psychosis like schizophrenia, because in very early stages of the disorder, it will be easier to feed them medicines or mix them with food, because at a later stage they'll become so suspicious that they may even start refusing food from you, and they might start cooking by themselves. In that case, only hospitalization will help. Schizophrenia is a mental disorder. It is not caused by any curse. It cannot be treated by any faith healer. So instead of staying in the dark because of unawareness, let's become aware. And in case we have someone like that whom we know, let's bring him immediately to a psychiatrist for treatment. Do remember to like this video or subscribe this video, and we promise to come back with another interesting topic. Till then, goodbye and take care.